corneal thickness and an epithelial thickness distribution in the myopic South Tamil Nadu eye using SDOCT. Dr. V. Vaduvakrishnan.
Good afternoon. I am going to present a study about corneal thickness and corneal epithelial thickness distribution in myopic South Tamil Nadu eye using spectral domain optical coherence tomography. Myopia or nearsightedness is one of the most common refractive error worldwide and poses a significant public health concern, especially in East and South Asia. The increased prevalence of myopia among children and adults is linked to genetic and environmental factors such as prolonged near work and reduced outdoor activity. So the accurate measurement of corneal thickness and epithelial distribution are essential for diagnosis and monitoring of various ocular conditions including myopia, keratoconus, dry eye syndrome, particularly in patients undergoing refractive surgery. So SDOCT has emergently high prescriptive non-invasive imaging tool allow detailed evaluation of corneal and epithelial thickness. My aim of the study is compare the corneal and epithelial thickness in distribution in myopic eyes among South Tamil Nadu subjects using SDOCT. The study design is prospective observational study for duration of 6 months. The study population is 150 eyes of 150 myopic patients aged between 10 to 40 years with manifest refraction spherical equivalent ranging from minus 0.5 diopter to minus 12 diopter. Inclusion criteria is age between 10 to 40 years and myopic is about minus 0.5 diopter to minus 12 diopter. Exclusion criteria is patient with keratoconus, history of contact lens wears, any current or prior ocular pathology other than refractive error, presence of eye disorder, and history of ocular surgery or trauma. Study basic investigation then corneal epithelials are measured using SDOCT. These measurements include total corneal thickness, epithelial thickness in central zone 2 mm zone, and epithelial thickness in 8 sector of paracentral zone from 2 to 5 mm referred as a ring 1, and epithelial thickness in 8 sector of mid peripheral zone 5 to 6 mm is referred as a ring 2. The patient was categorized into low myopia, moderate myopia, and high myopia. Data collections were performed in standardized manner. Difference in epithelial thickness between low, moderate, high myopia group are assessed, and correlation between epithelial thickness, patient characteristics such as age, center, corneal thickness, and intraocular pressures are assessed. Statistic analysis, descriptive strategies were used to summarize the data, including mean and standard deviation for corneal epithelial thickness. A comparison between myogroup or controlled ANOVA for continuous variable. Correlation analysis were performed, association between corneal epithelial thickness and other factors, and p-value less than 0.05 or significant. Ethical consideration was given. This table shows the demographic and clinical characteristic of study participant. This among equal distributions of population with higher male present is present, and this table shows a low wire. We collected 50-50 samples from each groups. This table shows us the corneal thickness and epithelial thickness in different myogroup. These tables suggested central corneal thickness is thicker in low myopic patient and thinner in high myopic patient. That is inversely proportional to them. Similarly, for central epithelial thickness also present. This suggests us next shows the corneal epithelial thickness distribution in different sectors. Among this, nasal impaired shows the higher thickness in low myopic patient and least thinner in superior quadrant. This correlation of corneal epithelial thickness with age and refractive error. The age is negative correlation. As the age increase process, the corneal epithelial thickness and the mean refractive spherical equivalent is directly related to the values. Discussion: non-uniform thickness of distribution of corneal epithelial thickness with nasal impaired sector being the thickest and superior significant thinness. The patient with high myopia were found to be thinner epithelial layer compared to those with low or moderate myopia. Our studies found that slight negative correlation between corneal epithelial thickness and age, which supposed to finding Einstein et al. Therefore, that epithelial thinning occur with increase in age. Unlike uneven epithelial distribution suggested clinical should contain regional epithelial thickness variation when they are planning for refractive surgeries. Thinner epithelium in high myopia possessed additional change for refractive surgeries, and thinner epithelium may contribute to undercorrection for post-operative complications such as epithelial growth. The study main focus on corneal epithelial distribution rather than total corneal thickness provides more detailed information that is clinically useful, particularly in screening of keratoconus and other pathological problems. Conclusion: individuals with high myopia tended to have a thinner corneal epithelium, and slight negative correlation was found between corneal epithelial thickness and age. No significant association was found between epithelial thickness, astigmatism, corneal vision, and IOP. The recommendation, understanding the distribution of corneal epithelial thickness is critical for optimizing clinical care in ophthalmology. Recognition of regional variation in epithelial thickness can improve detection of early corneal disease such as keratoconus before performing refractive surgery. Incorporating epithelial thickness measurement in pre-operative assessment could lead to better patient outcome in corneal surgery and management of refractive errors. These are my references. Sir, other studies and all, they didn't compare three groups. Recently, the Sankara et al. Had done studies among school pupils. They got tell that only prevalence. They didn't tell about reference. Sir. I have compared each low, moderate, and high myopic patients.
So, isn't this expected that the corneal thickness, the entire eyeball coat will become thinner as the axial length increases, especially if it's axial myopia?
Yes.
Scleral thinning is also known.
Yes.
So, it is already a known feature that all the coats of the eyeball will thin out. Have you assessed the per diopter change or something like that? That if they have 6 diopters, so much 10 microns will differ,
Yes, ma'am.
or something like
that's
that.
only I compared.
So for every diopter, how much change of CCT is there?
No, no.
Yeah, so that makes it more significant because these are the patients who will go for LASIK.
Yes, ma'am.
So that is the relevance of your study which you should highlight.
Thank you.